Welcome to Journey to 600. Today we're going to talk about cranial nerves. We're going to break it down by just talking about the cranial nerves, their name, their number, how to remember them, and then kind of grouping them together with the face, mouth, tongue, and then looking at all the cranial nerves related to the eyes, and then lastly, all the ones we hadn't talked about yet that didn't fit in a group. Starting off, there are 12 cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So cranial nerves can either be sensory nerves only, motor nerves only, or have sensory and motor. So one of the sayings to remember if it's sensory and motor is, some say marry money, but my brother says big brains matter more. So that's what those S's, M's, and B's are as you go down from 1 to 12. Then for knowing the order of the names of the cranial nerves, there's a lot of them, but one that I used to study was on. They traveled and found Voldemort guarding very ancient Horcruxes. And that is from Harry Potter. So if you're not a Harry Potter fan, that may not make sense to you. You can definitely look up some other ones that helps you best remember the order of the cranial nerves. Starting off, what is the difference between trigeminal nerve and facial nerve? So trigeminal nerve is the 5th cranial nerve and facial is the 7th cranial nerve. So these nerves are both sensory and motor. Trigeminal is sensation to the face and the anterior 2/3 of the tongue, but facial is the taste to the anterior 2/3 of the tongue versus just sensation. Muscle-wise, the trigeminal nerve is the muscles of mastication, so like chewing, but facial is muscles of facial expression. So think like raising your eyebrows and puckering your lips, blowing your cheeks out, smiling, things like that. So breaking it down, trigeminal versus facial related to sensory. So on the left is the trigeminal nucleus, and it has 3 branches that help supply sensation to the face. So the ophthalmic nerve, maxillary nerve, and mandibular nerve. So that all stems from the trigeminal or cranial nerve 5. And then for trigeminal, it also covers sensation to the tongue, which is the blue color on the tongue in the picture on the right. Facial nerve sensation is the taste to the tongue, which is denoted by yellow, and it's the ability to distinguish sweet, sour, bitter, and salty. Next, using pictures to look at trigeminal versus facial motor. So the left is trigeminal, so you can see the temporalis muscle, the masseter, and then the medial and lateral pterygoids that help with chewing and moving your jaw side to side, as well as opening your mouth. Muscles of facial expression, the list is a lot longer, but just think, like I said, raising your eyebrows, closing your eyes, puckering your lips, smiling. Those are all the muscles, or part of the muscles, for facial expression. Now, how do you test for the trigeminal nerves? Due to the trigeminal nerve giving rise to facial sensation, sensation will be tested by looking at if they can distinguish sharp touch versus blunt touch, soft, cold, or warm. The patient should be able to discriminate the sensation as well as feel the same between sides of the face. For motor testing of the trigeminal nerve, so you can palpate the masseter and temporalis and ask them to clench their teeth, and as they are elevated in their jaw, do you feel the muscle? For facial testing, sensory-wise, doing tongue taste, so can they discriminate between sweet, sour, salty, and bitter on the tongue on both sides? And then for motor, you're going to assess for symmetry at rest. Then you can ask them to raise their eyebrows, close their eyes tightly, blow out their cheeks, and smile. Next, looking at more of the tongue and the gag reflex and swallowing. So cranial 9 and 10 are assessed together by looking at the gag reflex. Cranial nerve 9 is the afferent portion of the gag reflex, and cranial nerve 10 is the efferent part of the gag reflex. Then looking at cranial nerve 10, that is responsible for the uvula. So looking in the back of their throat, it will typically deviate to the strong side. Then cranial nerve 12, looking for tongue atrophy. The hypoglossal nerve is just motor only to the tongue. So you're going to ask the patient to stick the tongue out, and the tongue will deviate to the weak side if it is not intact. Okay, for the eyes, we're going to be looking at cranial nerve 2 for visual field and acuity. So that's the optic nerve. And then you're going to look at cranial nerve 3, 4, and 6 to look at the actual movement of the eyes. So the oculomotor, trochlear, and abducens. Specifically, cranial nerve 2 testing, you're going to use a Snellen chart to test for acuity, and then to test for visual field, you'll be face-to-face with the patient, ask them to look directly to you and see how far they can see in each quadrant of the fields. You can hold up various numbers and ask them to tell you what number you're holding up. Then looking at cranial nerves 3, 4, and 6, so the cranial nerve 3 is responsible for the majority of the eye movements, as it innervates the superior rectus, inferior rectus, medial rectus, and the inferior oblique. The trochlear innervates superior oblique, which helps the eyes go down and in, and the abducens innervates the lateral rectus, which helps the eyes go out. So you will be able to test for cranial nerves 3, 4, and 6 by watching how the eyes work together to track your finger or pen light while maintaining their head still. The finger or pen light moves in an H pattern, then bring it to their nose and watch their eyes converge. So in this picture, you can see how you go up and down and move laterally and medially across, and then also up and down on both sides, as well as converge to their nose. Another thing to consider when testing the eye muscles and visual fields and acuity is looking at the pupillary light reflex, which is mediated through both the cranial nerve 2 and 3. So cranial nerve 2 is the afferent limb, meaning it detects the light and sends the sensory message. And then cranial nerve 3 is the efferent limb of the pupillary light reflex and is the motor response to light. So an intact cranial nerve 3 will constrict both of the pupils of the eyes in response to the light. So the last ones that we didn't really talk about is cranial nerve 1, which is the olfactory nerve, and it is sensory only for smell. So to test that, you would occlude one nostril and then see if the open nostril can identify odors like soap or coffee. Then cranial nerve 8 is the vestibulocochlear nerve. It is sensory only for hearing and balance. So hearing, there's various ways you can assess, but you can rub your fingers together and assess at what point the patient can hear as you move closer to the ears. So you want to start further away from the ears, testing one ear at a time. And a normal distance that they would be able to hear it is about 2 feet away. For balance testing, you can look at the MCAT-SIB or the sensory organization test. Lastly is cranial nerve 12, and it is motor only to the trapezius and sternocleidomastoid. So to test for the cranial nerve 12 would be looking at MMTs of the trapezius or sternocleidomastoid. So in summary, the mnemonic for knowing the cranial nerves, or the order of the cranial nerves, is on. They traveled and found Voldemort guarding very ancient Horcruxes. So that's Voldemort there, if you're not a Harry Potter fan, and some of the Horcruxes. Next, the mnemonic for sensory, motor, or both is some say marry money, but my brother says big brains matter more. To me, the cranial nerves to remember are the different eye muscles, as well as distinguishing between the trigeminal and facial nerve. So 3, 4, 6 are the eye muscles. 5 and 7 are trigeminal and facial. And something we didn't talk about specifically earlier is where these cranial nerves originate. So 3 and 4 originate from the midbrain. 5, 6, 7, and 8 originate from the pons. And then 9, 10, 11, 12 originate from the medulla. And as you can see, the picture on the left has all those cranial nerves labeled as they come out from the brain. Practice question number 1. During your examination of cranial nerves, you note the patient's left eye has difficulty tracking laterally. Which of the following cranial nerves is responsible? A. Cranial nerve 3, B. Cranial nerve 5, C. Cranial nerve 6, D. Cranial nerve 7. I'll give you a moment to answer. If you're not ready to answer, please pause. The patient has trouble tracking laterally, so we're going to be looking at eye muscles. So first we need to know what cranial nerves are for eye muscles, which are 3, 4, and 6. So B you can take out, and D you can take out, because B is cranial nerve 5, which is trigeminal, not an eye muscle nerve. You can also rule out D, which is cranial nerve 7, the facial nerve, and is not responsible for eye movements. So we're between A and C, and then you see that the eye has difficulty tracking laterally. It is done by the lateral rectus, and the lateral rectus is innervated by the abducens nerve, which is cranial nerve 6. So C is the best answer. If you had to guess, you would probably want to guess A, because cranial nerve 3 does do the majority of the muscles of the eye, but cranial nerve 4 is down and in. Cranial nerve 6 is out for eye movements. Okay, practice question number 2. During your evaluation, your patient reports difficulty with chewing. Upon further examination, the patient reports decreased sensation on the left side of their face. Which of the following cranial nerves is responsible? A. Facial nerve, B. Trochlear nerve, C. Trigeminal nerve, D. Oculomotor nerve. I'll give you a moment to answer. If you're not ready to answer, please pause. We're looking at a cranial nerve that is responsible for chewing, potentially, because they have difficulty with chewing. We're also looking for a cranial nerve that gives sensation to the face. So looking at all the answers, facial nerve, not the best answer, because facial nerve is muscles of facial expression, not mastication, so not difficulty with chewing. They would have more reports of not being able to smile or pucker their lips, things like that. B, trochlear nerve, which is cranial nerve 4, innervates the superior oblique muscle and helps the eye muscles go down and in. They had no reports of difficulty with eye movement, so we can rule B out. C, trigeminal nerve, is cranial nerve 5, and that does innervate muscles of mastication, so they might have difficulty chewing. And it does innervate the face and gives sensation to the face, and they do have decreased sensation on the left side of their face. So C is likely the best answer. Let's look at D. D, oculomotor nerve, cranial nerve 3, innervates the superior rectus, inferior rectus, medial rectus, and inferior oblique, so eye muscles. No, D is not correct. So C, trigeminal nerve, is the best answer. And as you can see, just bringing that picture back, the trigeminal nucleus breaks up into 3 branches and gives rise to facial sensation. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.